Hello everyone, and welcome to what might be the most important video you watch this year about your health. I want you to think about last night when you woke up this morning. Did you spring out of bed feeling refreshed and energized, ready to take on the world? Or did you experience what millions of people face every single day? That groggy, achy feeling where your neck feels like it's been twisted in knots, your lower back throbs with a dull, persistent pain, and you actually have to brace yourself against the nightstand just to sit up properly? If you're nodding your head right now because this describes your typical morning experience, then you need to hear what I'm about to share with you today. Because what I'm going to reveal isn't just about getting better sleep. It's about preventing serious long-term damage to your cardiovascular system, your spine, and even your brain function. My name is Sarah Chen, and today I'm sharing groundbreaking research from Dr. Richard Caldwell, one of America's leading physical therapists and sleep specialists at Boston Medical Center, who also serves as a consultant for the National Sleep Foundation. Dr. Caldwell has spent over 20 years treating patients with chronic pain and sleep-related health issues, and what he's discovered will fundamentally change how you think about those 8 hours you spend in bed every night. Here's what might shock you most. Dr. Caldwell's clinical research shows that approximately 70% of his patients suffering from chronic neck pain, herniated discs, cardiovascular problems, and even early cognitive decline have one thing in common that nobody talks about. They're all sleeping in positions that are slowly but systematically damaging their bodies night after night, year after year. Think about this for a moment. You probably spend more time researching which smartphone to buy than you do thinking about how you position your body during the roughly 30,000 hours you'll spend sleeping over your lifetime. But those hours represent the most critical repair and restoration period your body experiences. And when you get it wrong, you're essentially turning your bedroom into a place where damage accumulates instead of healing occurring. Dr. Caldwell explains that quality sleep accomplishes 3 absolutely essential repair tasks that become increasingly vital as we age, particularly after 50. Understanding these 3 core functions will help you grasp exactly why your sleeping position could literally be a matter of life and death for your long-term health. The first critical task is brain detoxification, and this process is truly remarkable. When you enter deep sleep stages, your brain activates what scientists call the glymphatic system. Think of it as your brain's sophisticated waste disposal network. During these deep sleep periods, cerebrospinal fluid flows through your brain tissue like a gentle stream, washing away metabolic waste products that accumulate during your waking hours. One of the most dangerous waste products that gets cleared during this process is beta-amyloid protein, which researchers have directly linked to Alzheimer's disease development. Studies from the University of Rochester have shown that side sleeping, particularly on the right side, makes this brain cleaning process work up to 60% more efficiently compared to other positions. When your sleeping position prevents you from reaching deep sleep stages or maintains physical stress throughout the night, your brain essentially operates with a broken waste disposal system, allowing toxic proteins to build up over time. The second essential task involves regulating your autonomic nervous system, which controls every involuntary function in your body. Your autonomic nervous system has 2 primary branches: the sympathetic system that handles stress and emergency responses, and the parasympathetic system that manages rest, digestion, and healing. During optimal sleep, your parasympathetic system should dominate, allowing your heart rate to drop, blood pressure to decrease, and digestive processes to function efficiently. However, when your sleeping position creates physical stress, such as compressing your airway, straining your neck, or twisting your spine, your body interprets these as danger signals. This keeps your sympathetic nervous system partially activated throughout the night, maintaining elevated heart rate and blood pressure levels that should naturally decrease during sleep. Dr. Caldwell has documented cases where patients' blood pressure readings were actually higher in the morning than when they went to bed, purely because their sleeping position kept their stress response system engaged all night long. The third critical task focuses on musculoskeletal repair and spinal decompression. Throughout each day, gravity compresses your intervertebral discs, while your muscles work constantly to maintain posture and support movement. These discs, which act as shock absorbers between your vertebrae, lose water content and become compressed during daily activities. Sleep represents the only time these discs can decompress, rehydrate, and absorb nutrients necessary for maintaining their structural integrity. A proper sleeping position maintains your spine's natural S-shaped curve while allowing surrounding muscles to completely relax. When your position is incorrect, certain muscle groups must continue working throughout the night to prevent injury, which means they never get the restoration period they desperately need. Now that you understand why sleeping position matters so much, let me reveal the 5 most dangerous positions that Dr. Caldwell encounters in his practice, starting with the 5th most harmful position. Position number 5 is stomach sleeping, which might feel comfortable and secure, especially for men who enjoy the feeling of their chest pressed against the mattress. However, this position creates 3 serious problems that become increasingly dangerous with age. First, stomach sleeping forces extreme cervical spine rotation. To breathe while face down, you must turn your head to one side for hours at a time, creating what Dr. Caldwell calls sustained rotational stress on your cervical vertebrae and surrounding ligaments. Your neck simply isn't designed to maintain this twisted position for extended periods. Dr. Caldwell treated a 58-year-old construction worker named James, who had been a lifelong stomach sleeper. James came to the clinic complaining of severe morning headaches and numbness in his right arm. After detailed examination, Dr. Caldwell discovered that decades of stomach sleeping had caused significant cervical spine degeneration and was compressing nerve roots that control arm sensation and function. Within 3 months of switching to a different sleeping position, James's symptoms virtually disappeared. Second, stomach sleeping creates mechanical compression of your respiratory system. When you lie face down, your body weight directly compresses your chest and diaphragm, making breathing more labored and shallow throughout the night. This leads to a subtle but chronic state of oxygen deprivation that affects every organ system in your body. Third, this position puts asymmetric pressure on your facial structure and temporomandibular joint, potentially affecting dental alignment and jaw function over time. Position number 4 might surprise many of you because it's often considered the healthiest option: unsupported back sleeping. While lying on your back can be beneficial, the traditional flat-on-your-back position creates serious problems for many people, especially those over 50. The primary danger is sleep apnea induction. When you lie flat, gravity pulls your tongue, soft palate, and uvula backward, narrowing your upper airway. For people whose throat tissues have become less firm with age, or those carrying extra weight around the neck, this can completely block airflow during sleep. Sleep apnea isn't just about snoring, it's a potentially deadly condition where you stop breathing repeatedly throughout the night. Each breathing cessation triggers an emergency response in your brain, causing brief awakenings that fragment your sleep and prevent you from reaching those crucial deep sleep stages we discussed earlier. Severe sleep apnea increases your risk of heart attack, stroke, and sudden cardiac death by 3 to 4 times. Dr. Caldwell treated Margaret, a 62-year-old teacher who complained of extreme daytime fatigue, despite believing she was getting adequate sleep. A sleep study revealed that Margaret was experiencing over 200 breathing interruptions per night due to her back sleeping position. After switching to a modified side sleeping position, her energy levels improved dramatically within just 2 weeks. Position number 3 is left side sleeping, which brings us to some fascinating physiology that most people don't understand. While side sleeping can be beneficial, sleeping specifically on your left side creates problems for 2 groups of people: those with heart conditions and those with gastroesophageal reflux disease. Your heart sits slightly left of center in your chest cavity. For healthy hearts, this positioning is generally irrelevant. But for people with congestive heart failure or enlarged hearts, left-side sleeping can alter cardiac filling pressures and potentially trigger uncomfortable palpitations or irregular rhythms during the night. More commonly, left-side sleeping exacerbates gastroesophageal reflux due to pure anatomy. Your stomach's entrance valve, called the lower esophageal sphincter, is positioned on the upper right side of your stomach. When you sleep on your right side, this valve sits higher than your stomach's acid level, creating a natural barrier against reflux. But when you roll to your left side, you're essentially tipping your stomach like a pitcher, allowing acid and partially digested food to flow directly toward the esophageal opening. Dr. Caldwell's patient, Robert, a 49-year-old accountant, suffered from chronic nighttime heartburn and morning hoarseness for years. Despite trying various medications and dietary changes, his symptoms persisted until Dr. Caldwell suggested switching from left side to right side sleeping. Within just 1 week, Robert's nighttime reflux episodes decreased by over 80%. Position number 2 is sleeping with an excessively high pillow, which creates what Dr. Caldwell calls chronic cervical flexion syndrome. Many people use multiple pillows or very thick pillows because they enjoy feeling elevated, or they've developed the habit of reading or watching television in bed with their head propped up high. This position forces your neck into extreme forward flexion, similar to the posture you maintain when looking down at your smartphone for hours. This sustained flexion puts tremendous strain on the posterior cervical muscles, which must work all night to prevent your head from falling forward even further. Over time, this leads to muscle fibrosis and trigger point development in your neck and upper back. More seriously, extreme cervical flexion can compress the vertebral arteries that supply blood to your brainstem and cerebellum. These arteries pass through small openings in your cervical vertebrae, and excessive neck flexion can reduce blood flow to critical brain regions. Dr. Caldwell documented a case involving Linda, a 55-year-old graphic designer who experienced morning dizziness and occasional balance problems. After ruling out inner ear issues and other medical causes, Dr. Caldwell discovered that Linda's habit of sleeping with 3 pillows was creating enough cervical flexion to intermittently compress her vertebral arteries during sleep. Switching to a single, properly fitted pillow eliminated her symptoms completely. Now let me reveal the number 1 most dangerous sleeping position, which might shock you because it seems so natural and comfortable. This is sleeping on your back, or side with your legs completely straight and extended. This position activates what Dr. Caldwell calls the iliopsoas muscle trap. The iliopsoas muscle is a powerful hip flexor that connects your lumbar spine to your thigh bone, running through your pelvic cavity. In our modern sedentary lifestyle, this muscle becomes chronically shortened and tight from hours of sitting. When you lie down with straight legs, your shortened iliopsoas muscle acts like a tight rubber band, pulling your lumbar spine into excessive extension and creating what's called hyperlordosis. This forces your lower back to arch away from the mattress, concentrating pressure on the small facet joints at the back of your spine. Dr. Caldwell treated David, a 51-year-old office manager who woke up every morning with severe lower back pain despite using an expensive orthopedic mattress. The pain was so severe that David had to roll out of bed sideways and use furniture to pull himself upright each morning. After switching to sleeping with bent knees, David's morning pain disappeared within just 5 days. This straight leg position is particularly devastating for people with existing disc problems or spinal stenosis because it maximizes pressure on already compromised structures during the hours when they should be decompressing and healing. After sharing all these dangerous positions, you're probably wondering what the ideal sleeping position actually looks like. Dr. Caldwell's research and clinical experience have led him to recommend what he calls the modified right-side lying position, which addresses virtually every problem we've discussed while maximizing the 3 critical repair processes your body needs during sleep. Here's exactly how to set up this position step by step. First, lie down on your right side. We prioritize the right side because it prevents the cardiac and gastric issues associated with left side sleeping while still optimizing brain detoxification through the glymphatic system. Second, adjust your pillow height so that when you're lying on your side, your head, neck, and thoracic spine form one straight horizontal line. Your pillow should fill the space between your shoulder and ear without lifting your head too high or allowing it to sink too low. Third, bend both your hips and knees to approximately 30 to 45 degrees, creating a gentle fetal-like curve in your body. This single action immediately releases tension in your iliopsoas muscle and allows your lumbar spine to assume its natural curvature. Fourth, and this is crucial, place a pillow between your knees. This pillow should be thick enough to keep your pelvis in neutral alignment, preventing your upper leg from rolling forward and twisting your spine during sleep. Fifth, if you experience any shoulder discomfort, you can hug a second pillow against your chest, giving your upper arm a place to rest and preventing your shoulder from collapsing forward. This position combines every advantage we've discussed. It optimizes brain detoxification, allows complete autonomic nervous system relaxation, maintains perfect spinal alignment, and can be sustained comfortably throughout the night. Of course, nobody maintains exactly the same position for 8 straight hours, and that's completely normal. If you wake up during the night and find yourself on your back, simply place a pillow under your knees to maintain proper lumbar support. The goal is to spend the majority of your sleep time in one of these 2 spine-friendly positions. Now, mastering. The ideal sleeping position will dramatically improve your sleep quality. But if you want to achieve truly restorative sleep, you need to understand 3 additional secrets that Dr. Caldwell shares only with his most motivated patients. The first secret involves completely reframing your relationship with alcohol before bedtime. Many people believe that a glass of wine or beer helps them fall asleep, but this is one of the most damaging sleep myths in existence. While alcohol does have initial sedative effects, it creates catastrophic disruption to your sleep architecture throughout the night. Alcohol severely suppresses REM sleep during the second half of the night, which is when your brain performs critical memory consolidation and emotional processing. As your liver metabolizes alcohol, your body experiences what sleep scientists call a rebound effect, causing your sleep to become extremely fragmented and shallow in the early morning hours. Dr. Caldwell's rule is absolute: no alcohol consumption within 3 hours of bedtime. This gives your liver enough time to process the alcohol before your natural sleep processes begin. The second secret is strategic hydration management. Frequent nighttime urination destroys sleep continuity more than almost any other factor. However, the solution isn't drinking less water, it's drinking smarter. Dr. Caldwell recommends front-loading your hydration by consuming the majority of your daily fluid intake during morning and afternoon hours. Begin tapering your fluid intake after 8 p.m. and avoid all liquids except necessary medications during the hour before bedtime. This allows your kidneys and bladder adequate time to process fluids while ensuring uninterrupted sleep. The third secret is creating what Dr. Caldwell calls a sleep sanctuary. Your body relies on 2 primary signals to initiate sleep: decreasing core body temperature and dimming environmental light. Your bedroom environment must support both of these physiological cues. Set your bedroom temperature between 68 and 72 degrees Fahrenheit. This might feel slightly cool initially, but this temperature range optimally supports your body's natural temperature drop during sleep onset. Eliminate all light sources, especially blue light from electronic devices. Blue light specifically inhibits melatonin production in your brain, making it extremely difficult to fall asleep and stay asleep. Use blackout curtains, remove electronics, devices, and consider using an eye mask if necessary. Finally, maintain complete silence or use consistent white noise to mask intermittent sounds that can trigger awakening responses even during deep sleep stages. Combining the modified right-side sleeping position with these 3 optimization strategies creates the foundation for truly restorative sleep that will transform how you feel every single morning. I know this information might feel overwhelming, especially if you've been sleeping the same way for decades. Change is never easy, particularly when it involves deeply ingrained habits. But I want you to understand something important. Every single night that you continue sleeping in a damaging position is another night of accumulated wear and tear on your body. The beautiful thing about implementing these changes is that you don't need to perfect everything immediately. Start tonight by consciously positioning yourself in the modified right side lying position before you fall asleep. It may feel awkward initially, and you might wake up in your old position. That's completely normal and expected. Give yourself patience and commitment for just 2 weeks. Your body has an incredible ability to adapt and remember positions that genuinely serve its needs. Within 14 days, you'll likely find yourself naturally gravitating toward this healthier position because your body will recognize how much better it feels. But here's what I need from you right now. I want you to make a commitment, not just to me, but to your own health and well-being. Tonight, before you go to sleep, take 2 minutes to consciously set yourself up in the proper sleeping position we've discussed. Place that pillow between your knees, ensure your spine is aligned, and give your body the gift of truly restorative sleep. Your future self, the version of you that wakes up refreshed, energized, and pain-free, is counting on the decision you make right now. Don't wait until tomorrow or next week. Don't wait until the pain gets worse or until you develop serious health complications. Start tonight and discover what it truly means to wake up feeling like your body has been restored instead of damaged during sleep. Remember, health is never accidental. It's the result of thousands of small, consistent choices made day after day, year after year. Tonight, you have the knowledge and tools to make one of the most impactful changes possible for your long-term health and quality of life. The question is, will you use them?